I'm Sonia Dunn, your host. We're here with our guest today, Alan Reyes, who is the Chief Operating Officer to the USO, the United Services Organization. Alan, thank you so much for being on our show today.
Hey, Sonia, thanks so much for having me, and thanks to your listeners. And we really appreciate the opportunity to talk about the USO.
So, being there in time of need is not something that's new for USO, is it?
Absolutely not. We turn 80 years old next year, and we continue to serve that same mission in times of war, in times of peace, in times of crisis, strengthening and connecting our service members and their families. So even as difficult as things are today for all of us, the USO, we continue to be always by the side of our service members and their families, especially during these trying times.
Now, has the USO's mission changed or has adjusted due to this big pandemic at all in regards to your mission?
Well, there have been changes. I would say our mission itself continues to be the same. Being there to strengthen and connect our service members, connecting them to family, home, and country. What has changed though is how we do that today in the environment that we live in with this COVID-19 pandemic, both here in the United States and around the world. So what has changed is the way that we deliver that mission of connection. And so much of that has been traditionally in our 250 plus locations around the world, our USO centers where people congregate. We've had to suspend operations in those facilities, but we've replaced them by making, great ways to connect service members and families through virtual programs, delivering stuff, maintaining social distance and all that. But it's very important that we keep, number one, our volunteers and our staff and our service members and their families safe and healthy, and that we do our part to combat the spread of the COVID-19 virus.
So honestly, this is what you do. You adapt as far as for the times. Because I remember as far as when I was on a tour, as far as the chairman at the time said, as far as they had telephones and you had to schedule telephones, and now you're doing virtual to be able to keep up with as far as people staying connected. Is it daunting to try to keep up with the changes of evolution in life for you guys?
I tell you, it's a challenge, but I think we have teammates that are up to that challenge. You talk about sort of the transition from things like phone calls to now the internet and staying connected. Not only are we keeping our service members and their families connected, our team globally around the world, all our hundreds and hundreds of staff members from Kansas to Korea to Kandahar, they're all connected via the internet. We use collaboration sites that everyone can access, talk about the programs that they're doing, share those good ideas, share those innovations so that we can continue to rapidly change the way we do business to support our service members and their families during this challenging time. It's been incredible to be a part of that. I'm very proud of our teammates that continue to do that. And again, our staff and our volunteers are always wanting to lean forward and take care of our service members and their families. We just want to make sure that we're doing it in a safe way for them and for all.
Speaking of measures of safety, you are a global organization. You're not here just as far as here in the U.S. You are all around the world. How are you taking measures to keep your volunteers and staff safe?
Sonia, that's a great question. Again, safety and health of our staff and volunteers is number one. And, early on, when the pandemic, for instance, really on the front end of it here in the continental U.S., we made a decision to suspend our operations at our airport centers around the country, and largely where many of our volunteers, particularly our elderly volunteers, serve at the USO. So we immediately said, hey, where are the most high-risk areas for our volunteers and staff, and eliminate those activities. In overseas, as an example, this pandemic started way ahead in the Pacific, in China, South Korea, Hong Kong, you name it, and our staff members there quickly also altered their operations. We were able to provide them masks, N95 masks as needed as things broke out there very, very challenging in a challenging way. I'd also say the last thing is, we continue to just really make sure that our teammates are following all the guidelines from the CDC around social distancing, making sure folks are staying 6 feet apart from each other, and we're not congregating in large groups. We need to do that, and so I think we've done a really good job on that front, but we need to continue that vigilance.
So you guys have been tasked to support USNS Mercy and Comfort. What does that entail for you guys?
Well, both of those hospital ships, and, I'm a member of the U.S. Navy myself in the reserves. And a decade ago, I actually served on Comfort when she was in Haiti to respond to the earthquake there. Yeah. And so, number one, as a service member and as a member of our American society, I'm very proud of those sailors, those medical providers that are on board both ships. The first thing for both of them is to make sure that they establish their operations safely and effectively in LA and in New York. And so a lot of what we're doing as the USO is we're coordinating with their leadership. We're looking for the right time for the kind of work that we can do to support those sailors and those service members that are providing medical support at the right time. So, we're relatively early into the deployment of both of those ships, and those crews are working hard to make sure that they're keeping folks safe. We are in communication, though, with the fleet commanders, with the ship leadership themselves. We expect to be providing a lot of morale and welfare type equipment that they can use on board the ships so that they will be taking care of themselves while they're off watch. When things get better in terms of, contact with other individuals, we could probably start doing more of our traditional USO programming and provide, food and comfort to them there on the ship and the pier. But we have to be very careful about that up front, as you well know, Sonia. So we're the best thing we can do is to stay very close communications with those hospital ships and their leadership, make sure that we can support them when they're ready for that support.
Have you seen an outpour of needs here domestically from families as far as seeking your services, as far as during this as far as crisis?
Absolutely. Families, military families, like a lot of families here in the United States, are going through a very difficult time trying to adjust to this new normal. Working parents with kids that are home from school, trying to find ways to, keep busy, engaged, and active. Yes. So our USO centers in military communities here in the U.S. have responded. A couple of examples. We have lots of great military family programming and entertainment and entertainers that are starting to talk to our service members and their families via, online platforms, try to provide them that direct connecting experience in a virtual way. Other things that we're doing, it was a great, just as kids are starting to come home and had extended spring breaks, a lot of our USO centers would package up the goods, food and comfort items and other things, and turn them into essentially care packages that we would then deliver to those families. Again, contactless delivery, staying far apart from each other. But instead of them coming to the USO, we were bringing the USO to them in their homes, quarantine troops even. So those are the type of things that we will continue to do in a safe manner to make sure that we're keeping those military families connected to each other and to their broader community.
This is a big undertaking as far as, this goes beyond your mission. Well, it is your mission, but it's going beyond that due to the exacerbation of the pandemic itself. So what does the USO need from us here at home, who are at home, as far as are you guys needing any type of support, and how?
Well, I tell you, the USO, and we started this at the beginning of our conversation, Sonia. We in times of peace and war and crisis, we're there supporting our service members and their families. We consider ourselves one of the best ways for the American public to support our service members and their families. The USO isn't about places and things. The USO is about people, right? So our people are there, 30,000 volunteers, hundreds of staff members every day. the best way, I think there's a couple ways that people can support. Obviously, we're a nonprofit organization. Financial support's always welcome and needed to make sure that we have the ability to support our troops and their families. USO.org is a great place to go and figure out how to help in that way. There's also ways, maybe not today, but certainly, as we move towards better days, getting out there, volunteering with us, making sure that you're there to provide support to our service members and their families directly. Lots of ways to do that, both physically, in person, and virtually. So, again, at USO.org, opportunities to volunteer, opportunities to contribute. There are great ways that every individual American can support our service members and their families through the USO.
Now, does the USO have an app as well?
We do. Thanks for the reminder. We have a mobile app. You can go to either the Google store or the Apple store and download it. It's USO is the name of the app. It's a great way for service members and their families to learn about the programs that we offer for them, the locations we have around the world, and it's a great way to be able to check into our USOs as well. So the mobile app, our website, those are great resources for everyone to go and check out what they can do with the USO.
Alan, thank you so much for as far as giving your time to us today to talk about everything that the USO is doing in the midst of COVID-19. I appreciate your time.
Well, Sonia, I appreciate your time, and I would tell you thank you personally for what you have done with the USO, going on our tours, knowing more, learning more about what we do for this military community, and sharing that with your listeners and your readers. We really appreciate the opportunity that you provided us to allow folks to understand more and support what we do for our troops and families every day.
Thank you so much. As far as you guys are welcome back anytime, Alan.
Thanks so much. Looking forward to it.